uh, about fungating wound. Last week we already learned about bed sore management and all. So that session was taken by the same faculty only. We all familiar there, no need of further introduction. I welcome back and overview.
Thank you very much. Good afternoon, everyone. So let us go directly to the session. Last time session and treatment, I hope you remember all, right? So further we will be discussing about different kind of wound, uh, but most of the things are similar. Okay, so let us see about this fungating wound. Okay, so when you call it as fungating wound, what is it? So let us start from the beginning, that is about the definition. Okay, so most of these wounds are the result of infiltration of the cancerous tissues in the epithelial mass and surrounding blood and lymph vessels. Okay, so you can say it is a kind of complication that has developed in the patient in advanced disease. Why it has taken place and when it can be seen. So if you say that uh, when the cancer cells are migrating to other areas, there also it can cause this kind of ulcer. Okay, so not necessary that only when the patient is having uh, like skin problems at particular type of cancer, like say for example in case of breast cancer or in case of external genitalia, it is not so. Okay, it can even happen because of the migrated uh, cancer tissues. Okay, or you can say because of metastasis. And of course, it is very common in case of skin cancer. So why it is so important to take care of these type of wounds? Okay, so it is said that these numbers are taken, of course, from the research. So around 5 to 15% of cancer patients, they are bound to develop fungating wound. Okay, so it becomes very traumatic when this kind of wound is on the uh, body parts, and that too when it is on the visual side. Okay, say on the open sides, right? Because it will be seen by others also. How much you try to hide it, the patient is not able to do hiding completely. Okay, and he will feel very embarrassed. So it will be kind of visual reminder 24 into 7, right? Other people may say it for a short period of time, but person who is suffering with it will be saying it all the times. Okay, so it causes a great psychological trauma also. Plus it will have other problems like pain, exudates, it can cause even bleeding and malodor. Okay, so if it is not treated properly, then all these things will go on increasing and it will cause lot of damage to the particular wound site. So it will appear as a cauliflower, okay, and it will grow very rapidly. It will ulcerate, okay, and it can even cause fistula, create fistulas with the underlying systems, or you can say cavities. Okay, and because of that the person will have lot of other symptoms that we discussed in the last slide. And most commonly where you will find such wounds, so in females, if you see, that will take place over the breast in case of breast cancer. Okay, uh, other cancers that are very common that are likely to develop this is head and neck cancer. Even soft tissue sarcoma also can develop into this type of ulcer or this type of wound. In case of kidney cancer, cancer of bladder, lung, ovary, vagina, colon, and penis, in any of these, it is quite common. And each will have its own presentation. Okay, no two persons are same. Likewise, no two uh, fungating wound will look alike. Okay, so you have to be very watchful when it is developing and how big it can develop, because it will proliferate very fast. So this is the process of development. So fungating wound, there is rapid proliferation, and within no time you will find a big cauliflower appearance. It causes lot of ulceration because of lot of uh, you can say uh, oozing is there. Okay, so it is damaging the surrounding skin. Okay, and you will see a crater like thing. So that is surrounding, there will be boundary. Okay, and in the middle there will be lot of exudates. Okay, so it will look like volcano. Okay, then it will also do it will erode the sinuses. Okay, and because of that, what will happen, the interstitial tissue uh, that fluid should get collected, that is not coming into the blood vessel, but it is coming out over the skin. So there will be lot of exudates. Okay, and why the symptoms are found? So here what happens is vascular deficiency takes place. Okay, because cancer cells have eroded the small vessels. Okay, and because of that, what will happen? It will affect the blood flow to the particular local area, and there will be less perfusion of the cells tissues with the blood, and it will further cause necrosis because there will be lack of the oxygen and nutrition. Now, because of the abnormal lymphatic vessels, what will happen? As I said, interstitial fluid will increase. Okay, and there will be more pressure at the local site. Okay, so what will happen? It will further collapse the small blood vessels, and because of that, there will be lot of exudate because the fluid is not collected by the lymphatic vessels. Okay, now because of the excessive proliferation, what will happen is the pH of the extracellular fluid will change. Okay, and it will be of the acidic nature. So that will cause problem in the clotting. Okay, so because this mechanism is lost, what will happen next will be bleeding. Okay, so when you are trying to take care of the wound, trying to clean the wound, small vessels will easily bleed. And if the major vessel is involved in the wound, then naturally the bleeding amount will be quite large. So when we are dressing this type of wounds, or carers are taking care of the patient, clear instructions should be given. Now, because of course there is necrosis, but because of the exudates, now it is very moist. Okay, so it is bound to attract other microorganisms also, and it will have more and more microorganisms, more and more infection. Okay, now these can be aerobic also and non-aerobic also. Okay, so because of that, what will happen? They will break the fatty acids in the local area, tissues will be lost. Okay, and because of that, there will be lot of odor. And you can even find out when the person though is lying in the house, from the gate itself, you will find out that okay, somebody is there with the fungating wound. That much of stench will be there. So, how to manage such kind of wound? Of course, when this wound is quite large and because of its nature, here what is expected is that we provide comfort to the patient rather than healing of the wound. Okay, so that type of symptomatic control should be done. So to start with, where to start from the assessment? Okay, so doing holistic assessment of the patient, find out his physical complaints, find out his psychological problems, okay, try to find out his social problems, and of course the spiritual problems. Why we need all these things? Because we want to give maximum comfort. So unless holistic care is given, patient is not going to get enough satisfaction, okay, enough comfort. So that's why it is very important. Okay, so here lot of psychological and social issues also will be there in both patients and the relatives. So things are very getting now complicated. What is the importance of assessment? Of course, we need assessment. And as nurses, all the shifts we continue doing assessment because our care will depend on the how much problems patient is having, right? So monitor the patient and how much effective is our treatment, that will also uh, noted by this, or you can say evaluation of our treatment or any symptomatic care will depend on this. So whether patient is getting any kind of side effects of whatever uh, ointments we are using, right, what care we are giving, any medicines we are giving, whether patient is having any side effects, how much patient is improving, all those things will be very much important. So assessment is must. How is the quality of life of patient? Okay, so we can find out that also. So you can imagine that patient is having this kind of wound. Okay, so let me ask you to jot down a few points. What kind of under each four domains, okay, what problems patient will be having, and you can share in the chat box. Okay, so just we'll take 2 minutes to do assessment. Patient is having this kind of wound. So what will be the problems of this old woman? And another person is having wound over the limb, okay, maybe upper limb or lower limb. So what will be his problems? Okay, so let us do fast assessment. Suppose the patient is in front of you and you are jotting down the problems. So write in the chat box what you will find. Then we will discuss one by one. Yes, pain will be there. Good. Smell will be coming. Okay. Bleeding is there. Pain is there. Then other problems. Anyone can say about the social problems, or another person can tell about psychological problems. Yes, difficulty in chewing. Good. Discomfort. Yes. Shame. Feeling of shame. Yes. Right. No one will visit. Yes. Very good. Anything else comes in your mind?
Social
Like
isolation.
dependency.
Yes. Dependency. Yes.
Social isolation.
Yes.
Social
Isolation.
isolation. Will be
Yes. Social isolation. Yes.
avoidance.
Very good.
Yeah.
Mhm.
And depressed.
Depressed. Yes. Yeah. Okay. So, many problems, right? So let us see. So, of course, where is the wound, right? So location is very, very important, as well as size of the wound is also very important, because our dressing will now is going to get more and more large, right? What type of tissues are involved in the wound, right? How much you can say blood vessels are involved, right? So that will will also cause, because exudates will be there, right? Then odor will be there, right? So that you had included. Pain level also, because of the wound, and at the same time because of the dressing also, right? Okay. Then surrounding tissues, right? We just said that pH is changing. So there will be lot of pruritus also, right? Surrounding skin will be very soggy, always moist, right? And it will cause lot of problems. So there also some injury to the skin will be taking place. Then how much activities are affected, right? Daily living activities. What is the effect of the wound on these things are also very important, because you can say that when the patient is not able to do his daily activities, he will feel embarrassed, right? As he has to depend. So far, he was very fine doing his whole work himself, and now he is dependent on somebody else. So other person is getting enough time or not, right? That makes a huge difference. What is the, as we said that, okay, now bulky dressing is there, so whether the patient is comfortable with it or not, whether the dressing is keeping in place or not, or it is coming off, right? And of course the presence of infection, right? So these are just to name a few physical problems. What about the psychological issues? Okay. To assess the psychological problems, we have to put our feet into his shoes, right? So feel his pain, right? Then we are able to judge better, identify the problems in a better way, right? So here very unpredictable physical symptoms are there, right? And also lot of time consumption in dressing and all other things. Appearance has also changed, right? So he will be totally feeling of disgusting. Okay, he will feel as if he is losing his dignity and confidence, even relationship with the family members. And patient may be having lot of communication difficulties, so he's not able to express his feelings, right? And bulky dressing will cause lot of cosmetic effect also, right? Where it is, that is another thing, whether the person is able to hide it or not, right? Social isolation, rejection from the family, from the society, and he may, I mean, non-acceptance, right? So he's not able to cope up enough, right? Coping mechanism is totally lost, and because of that, he may use denial uh, to the limited prognosis that can also happen. He might have been told that now you have very few days to live, many things, right? Yeah. So all the time we hear the patients and relatives asking how much time he is having, right? To know many things. They may have many plans in their minds, and half of the times they don't share also, right? And because of that, they feel more and more depressed, embarrassed, right? All these feelings will be there, and he will be constantly feeling fearful, right? Because everyone fears death, right? No one likes to die, right? So that is a constant fear. And no anybody cannot give any time, right? It all is in God's hands. So it is very difficult to identify and assess this particular area, but with good communication skills we can do a lot of uh, help to the patient and the caretakers. What about the social issues? Okay, body image will have, of course, great impact on one's identity and relationship. Uh, Even with the spouse, it will mean a lot. Okay, and if the patient is female, then she will feel totally lost. Uh, Confidence will be lost, and she will feel less attractive. Uh, how to control her emotions, or maybe the spouse, it is very difficult to share her feelings. Okay, and they will feel neglected, and eventually they will withdraw from the society, right? So we need to identify symptoms and do proper assessment, right? Whether patient is having any kind of you can say going into depression, or what are the signs and symptoms of anxiety, and all these things need to be assessed very carefully. Patient may have lot of problems economically, right? Every now and then the patient may have to go for dressing, and at home it may become very difficult to dress the wound. Who is taking care of the patient? All these things are very delicate issues to be discussed, so we need to find out in proper way. This question always is there: why me? Why it has occurred to me? Patient is very angry, he may not give you good, proper answer, or the way you like to hear answers of your questions, right? Patient may feel dejected, rejected from the community. He may take it as God's curse, or the society may think that okay, this family is cursed family, so keep away from them, or they may be driven away from the uh, village. That kind of thing can also happen, and many of the patients, they lost their faith in God, or the opposite can also happen, that patient becomes and carrots become extremely religious. So both the things are there. So we need to identify, take care of spiritual gurus if possible, when we are trying to solve their problems or trying to answer their questions. Nothing wrong in that. So when we are doing management, all these things should be taken care of, right? So patient is having pain, so do the assessment of pain, right? So PQRST you must be knowing, and how to go about it, right? Then bleeding can also occur, right? So how to manage bleeding? Then there will be lot of exudates, so how to go about the dressings, how to clean, and how to dress the wound, what material can be used. There may be mal order also, right? So how to decrease the odor from the wound as well as from the environment, and of course the maggots infestation, right? If it has taken place, then how to do, right? And of course, secondary infections of the wound, how to manage. So our care will depend on these things. You can say Hope's model is also quite good to remember, right? So we should not forget doing assessment in any of the areas, right? So then we can develop good care plan for individual patient. Uh, Regarding the care, many times it can happen that the treatment of the cancer, that is radiation therapy and chemotherapy, can help in this type of wound. Okay, so the wound will become smaller in size, and the problems of bleeding, exudates will also, pain also will reduce. So that can also help. Then debridement of the tissues can also help. Uh, in some of the cases, surgery might help. Control of infection can be done with the help of systemic antibiotics also. And when there is deep pain, many times patient may tell you when you are doing assessment that he is having aching type of pain or stabbing type of pain, continuous pain, right? So at that time, depending on the WHO pain ladder, we have to give the analgesic drugs. And last time also we had discussed about extra dose of analgesic drug before dressing. Okay, so that should also be followed. If the patient is having burning or stinging type of pain, then local application of lignocaine jelly or opioid drug can also help. So here you will be soaking the dressing uh, just 10 minutes before, and it will alleviate the pain during dressing. So this can also help. And if you are applying matrogel, say for example, then you can make a paste with lignocaine jelly of matrogel powder and then apply it over the wound. That is also helpful. Incidental pain, which is occurring, say for example, only on movement, then ketamine can be given sublingually. But of course, care should be taken because there can be side effect like increase in the blood pressure. So bleeding can take place. So we have to see into it. What about mal order? Okay, so in addressing this issue, what we can do is use of the uh, matrogel, right? Last time also we had discussed. So how to clean the wound first, right? So daily bath, ask patient to take good bath. Okay, so that will remove all the slough. Okay, so bad odor will reduce. And after that, of course, you are cleaning wound with the isotopic saline, right? So that will clean the wound of all the bacteria and dead tissues. Then metronidazole powder can be applied, sprinkled over the wound. Even irrigation can also be done with the help of metronidazole pint, right? That comes in the bottles, so that can be used. And even nebulization can also be given with so in chamber, what you have to do is, as this helps especially when there are pockets, right? So when there are deep pockets, you can place metronidazole liquid in the chamber of the nebulizer and then hold it near the wound. So it will penetrate into the cavities. Okay, so that's how it can be helpful. Okay, this already we discussed that lignocaine jelly mixed with matrogel powder will help in when the patient is having painful wound. How many times dressing should be done? Now, this will depend on how much exudates are there in that particular patient, how much soggy the dressing becomes, how much wet it is becoming. Okay, so generally it is said that twice in a day is good, but as I said, depending on the drainage. For infection, what to do? So here you can give systemic antibiotics or even topical antimicrobial agents also can be applied. Uh, what about the smell in the environment in his room? Right, that becomes a big issue because patient and the relatives will be staying there in that type of environment 24 into 7, right? So what care can be given? So in this you can make use of because again all the patients may not be able to use the aerosol sprays, right? So we can use charcoal pieces that can be kept under the patient's bed in a ball. Okay, even the newspaper cuttings can also be placed under patient's bed sheet. So the carbon in the newspaper will absorb all the odor molecules. Okay, so it will help in reducing the order in the environment. Other things are like incense sticks are there, then kapoor is there, right? So mopping of the floor with good Lysol solution or phenyl solution, that also can reduce bad odor from the environment. Okay, so these things should be remembered and advised whenever required, because otherwise what will happen, patient will not be able to eat well, right? Patient will not be visited even by his own family members. है. So these things will affect greatly on patient psychological problems also, right? So we want to reduce all the types of problems, so this is another beneficial thing. Okay, so right. So this we just discussed that it causes lot of problems. It will affect quality of life issues of the patient, right? And moderate or large quantities of exudates are found, mainly because how many vessels are affected by the tumor cells. Okay, and how much is the permeability. So as it will increase, naturally there will be large amount of exudates coming out, and of course the action of the bacteria at the local level, right? So they will also release lot of uh, uh, problems. So if the exudate is not controlled, then other things like soiling or and the peri-wound maceration will take place, because surrounding tissues will get irritated very much. Okay, and patient will have lot of itching. So he may scratch, and there will be problems because of the injury, because of his own nails. So we have to be quite careful. Now, what kind of dressing materials should be used? So many times, most of the times we use the regular cotton and gauze pad, right? But in this, when there is large amount of exudates, uh, dressing materials like alginates or foams, right? That kind of thing is also used. So they will be uh, quite a bit more absorbent, you can say. So that will help in small dressing, but large amount of exudate will be absorbed from the wound. So that is why the dressing will not be so bulky. Okay, so cutting the diaper or even sanitary pads in the same shape and of the wound, and keeping it over the wound will help. uh, Treatment of infection with antibiotics we just discussed. Okay, even local materials like honey or silver or iodine is also very helpful because of its antimicrobial properties. So they can also be used. So here barrier film should be, so karaya paste is applied, right? Or that is generally mixed with the egg white, that is applied as barrier film. And even silver paste is also there, that can be applied as barrier film, so the surrounding tissues will not get macerated. Okay, so that is how it is helped. And as discussed before, palliative radiotherapy may be beneficial in reducing even exudates. Okay, so these are generally the uh, care points for the exudates. So in this table, I have tried to give type of dressings and their benefits. Okay, so depending on the patient's condition, we can use various things like foams, calcium alginates, how they are useful, honey, how it is useful, silver ointment, and on how it is useful. That is given in this table. And of course, I will be sharing this PPT with you, so you can also go through many of the things you might be using also, right? So this is a kind of revision. Okay. Even Dakin's solution, that is also quite useful. So that is sodium hypochlorite, right? So that is also quite useful. It is broad spectrum bactericidal effects it has, and it also removes the necrosed tissues, and that's how it helps in removing bad odor from the wound. How to deal with the bleeding problem. Okay, so when we are doing dressing, we might injure small blood vessel. Okay, now it has become very fragile, so slightest disturbance will cause bleeding. So at that time, local application of pressure can be done for 10 minutes, so that will stop bleeding. If it is more still bleeding, there pressure you may require to give for longer period of time, right? And if the wound is infected, then treatment of it will help in even taking care of bleeding also. Then topical application of sucral fat powder will also help, right? What it does, it forms coating, okay, and that's how it stops the bleeding. And systemic use of ethamsulate and tranexamic acid is also useful. Sometimes adrenaline pads also can be used, but then also it also causes side effects of elevation of pressure. So bleeding can take place. So one has to use it carefully. How to empower caretaker is very, very important, right? So last time also we had discussed this, how to prepare a normal saline solution and how to prepare sterile dressing material at home, right? So this is again a revision slide, and here the patient is having bleeding, right? So what we will do, we will advise him to use dark color clothes. He can keep such pieces ready so that whenever there is bleeding, the wound can be covered with the help of dark clothes. Okay, because seeing at the blood in large amount, patient, caretaker, and if the children are at home, then all will be panicking, right? So we don't want to create more panic. Okay, so that can be used. And how to dispose of the waste material is also very, very important, right? Because otherwise it will cause lot of aesthetic issues. So that we have to advising. Mostly, if the hospitals are nearby, then they can be discarded. And if generally at home settings, it is burned. And regular follow-up with the healthcare team. And what else healthcare team has to do is regular documentation whenever they are doing follow-up visits. In case the patient has developed maggots, so it should be very clearly told to them that maggots are happening because of the flies that are attracted because of so many things towards the wounds, and they sit there and lay eggs there, and out of it develops comes out the maggots. Okay, so it is the sole reason behind it. So improve his environment uh, in such a way that no flies are found, right? So regular cleaning and dressing of the wound as well as the environment is very, very important. Taking care of the maggots maggots, how to go about is there are many solutions, but most common solution that is used is the turpentine. Okay, so you can keep the swab soaked in turpentine near the wound. Okay, so it will cut off the oxygen supply uh, to the maggots so that maggots will jump off the wound. Okay, so and at that time you have to catch them. And you have to remember one more thing, and not to follow the maggots into the wound. Okay, otherwise what will happen? The tip of your thumb forceps will injure the uh, minute capillaries lying there. Okay, so we don't want any further injury of the wound. And this type of dressing should be repeated for 3 to 4 days. Each time you have to count them also. Okay, and where you will discard them, you have to collect in a ball where or kidney tray where again you will be putting some turpentine and collect the maggots into it, so they will die and then they can be flushed in the toilet. When doing dressing, it should be seen that the wound is completely covered with the help of whatever dressing material is used. Okay, so and when applying the micropore, one has to remember that there should not be any gap left. The surrounding tissue over the wound area, over whatever you have dressing applied. Okay, so all the boundaries should be covered nicely with the help of the tape. Okay, otherwise from those gaps it can uh, go inside. So these are other applications, other solutions that can be used like mineral oil, ether, chloroform, ethyl chloride, mercury chloride, okay, creosote, saline, or so many materials are there with which we can clean this type of wounds. Okay, in case of maggots infestation. Okay, surgical debridement can also help. Okay, but another thing that should be reminded is that patient must sleep in the mosquito net as far as possible so that flies don't come and sit on his wound. Okay. Other treatment combination is systemic ivermectin that can be given. Albendazole is also given and clindamycin. It is also known as triple therapy that is quite useful in the case of wounds with maggots. Right.
Excuse me, ma'am. Can we put dextrose into the maggots for the removal of maggots? Is there any dextrose?
I have not come across use of dextrose in this wound. Maybe if others have come across, then we can discuss at the last.
Okay.
Okay, fine. So other psychological issues we discussed, counseling should be done, how to cope, use coping mechanisms, distraction, right? So how to go about it as nurses, we should know, right? So that we can deal with patient's anxiety very well. Social issues, counseling again is very important. Social worker can also be involved, right? Support from NGOs can be taken. So many things will be there. So many problems will be there in the family, education of kids, and a lot more, right? Daily rations, everything. So how to go about it? How to get? How to avail different government schemes? Many times, patients and relatives don't know how to get benefits. Okay, so we can help if we know about the schemes then and how to go about it, what records are required, right? What certificates they will require. Many times doctors also give certificates so that they can avail government schemes. So these things should be helped out. So as nurses, we are like liaison between so many things, right? On one side, patient and caretakers are there. On the other side, there may be government schemes. It may be doctors. It can be NGO, right? So we need to try to know more, equip ourselves with more knowledge so that we can help patients and relatives. Spiritual issues also we said, right? We discussed. So that is also very, very important. So with this, I would like to end my presentation. Yes, now if we have points for discussion, we can do.
Thank you, Anna, for the presentation. Anybody have any doubts on this? Please ask. So Renuka ma'am was asking one question.
Yes.
Okay. So I think what about we would like to hear from others. Anybody have any experience using dextrose to remove maggots? Anybody? So as I always request, please switch on your videos and involve the discussion.
Actually, I had some experience about when I am in student nurse. More than I think 15 years ago, I
Okay.
have seen that one of the senior nurses had put some dextrose and suddenly the maggot was died.
Oh,
I have that experience, yes.
so I have no experience on using dextrose. I don't know Anna whether then Anna has any. No, Anna is also don't have any experience on that. We usually prefer a turpentine oil, not directly pour. We take turpentine and soak with the gauze piece and keep close to the wound. What the turpentine oil do is that will reduce that atmosphere oxygen. So that time that the maggots will come out to take oxygen. That time we will take it out with the help of an arthroposis. So turpentine oil is reduce the oxygen level in that particular atmosphere. That is why we prefer the turpentine oil for removal of maggots. So I have only that experience. So anybody have any other experience for maggots removal? Anything? Uh, if you don't have any questions, please ask another questions. Leave this. Any other questions?
Many times patient can have allodynia, right? So at that time, if we are using mosquito net, then even the at in such patients you can have open dressing also.
Yeah.
So depending on the, I mean, pain assessment is very, very important, right? And strict atmosphere is very important.
That is very, very important. When we do the assessment, we need to do the proper assessment on pain. We already know there are two different types of pain. One is nociceptive pain and neuropathic pain. Most of the time, this kind of patients will get two different types of pain. These two pain will be there. So you have to make sure that whether the patient is having any neuropathic the thing is there. So if they have a neuropathic pain there, you have to treat accordingly. That time your the systemic analgesics may not help well. So because sometimes superficial pain will be there. So you have to do the proper assessment. And also, if you don't assess well, definitely they will suffer with pain, and also they will develop maggots formation again and again. Because I have an experience. So we have one patient. She was a news reader, a highly educated lady. She came with maggots, and then we had a discussion with her, and then we taught her how does maggots come. You have to cover the wound always. That all things we taught her. Then yes, then she told me, okay, yes, sister, I will follow all those things, that kind of thing. Okay, I said, okay, you can follow. Whenever you need any help, please call me, or anytime you can come to us. That kind of assurance also I gave to her. And then she go back. She then after 2 weeks again she has developed maggots. She came with maggots. Then we thought, why say such an educated lady, she knows very well how. Now she understood how does maggots come. All those things she knew that. So but then we all thought like that, why this that lady came with maggots again. Then I did a good assessment. Then I came to know that so when she has a allodynia, like if the dressing materials touch that wound, she was not able to tolerate. She has developed pain, like neuropathic pain. So what she told me was, when she go back to her home, she suddenly she remove all the dressings and opened that wound in the atmosphere, and under the fan she lying down. She was lying down. So that time, the maybe because of that time the flies will, as Anna said, if the infected wounds are there, the house flies are attracted with that. So if they touch the wound, definitely they may lay eggs. They may definitely lay eggs. Within 8 to 12 hours, come out with maggots. So that is the pathophysiology. So then she now then we understand. Okay, this may be because of neuropathic pain. We treat the neuropathic pain. After that, no maggots. She was quite. She was able to manage with dressing and all. So the assessment of pain is very important. Whenever you have seen a patient with fungating wound, you have to do the proper assessment. And another important points you should remember is, in front of the caregivers, they will not tell the truth. They always hide the truth. So if you do the individual assessment, definitely they will tell the truth. So if possible, you can do the individual assessment. Okay. So that is also another important message you have to keep it in mind. Any other thing you want to add, Anna?
No, sister, I think we can go for the
Yeah, no,
presentation.
unfortunately, the case presenter is not joined today. So I have a case scenario I will share now. So that we will discuss. We will
Okay.
ask to the participants.
Okay.
Can anyone please read it out? So I want to see you all. Please switch on your videos.
65 years old man diagnosed with cancer, right buccal mucosa, cheek, living with his family. He came to OPD for cleaning and dressing. His main complaints were foul smell and exudate. While doing the dressing, he asks, "My wound is healing well, isn't it?" How will you respond to this question? Why God punish me like this?
So this is the case scenario. So I hope all of you are understand well about the patient scenario. So while doing, you are the nurse. You can just imagine you are the nurse doing the dressing time. The patient is ask you to, my wound is healing well, isn't it? Now we understand that this kind of wounds are not at all cured. So this is a non-healing ulcers. Day by day, the proliferative growth will be there. Signs and symptoms will be more and more. So that kind of things will be there. This patient is came with the foul smell and exudate. While doing the dressing, he was asking you, "My wound is healing well, isn't it, sister?" So how will you respond to this question? The first question. And the another question is, why God punished me like this? So we would like to get your answers first and then we will act. Please unmute yourself and talk, or you can put your answers in the chat box. This is the usual question.
Do the correct assessment.
Yes. Ma'am, your voice was breaking. Could you please repeat?
Do the correct assessment. Pain is there or not. Or
How will you do the assessment? I need this question's reply. How that my wound is healing well, isn't it, sister? How will you respond?
First, we'll have to discuss the patients and we have to reassure the patient and slowly we have to explain the condition of the wound and all the time we'll have to give the message to the patient that we are here to assess you and we are going to look after you more and more and we are keeping with the good relationship with the patients and things and we have to show that we are with the patients. And other than that, thing is the God punish me like these questions. We have to give some spiritual support too.
Okay, how will you give some spiritual support?
And according to his religion, we'll have to discuss some question. Don't worry that God will give some support to you that you have met us. That like this when and we are giving good support to you and after that you will be healed normally it will take time like this and believe the gods and things.
So now we thank you, Ranika ma'am. So we know this is a non-healing ulcer. So we learn from the communication session. Don't give false hope to the patient. So how do you give this wound will get better or
Suddenly,
well?
actually, suddenly we can't tell that it's not healing wound, but that's why we are allowed to give that it's not healing. But it will take time. Like that, we'll have to gradually we have to tell the condition of the wound.
Okay. So after 2 weeks, the wound condition is again worsening. How will you respond?
Then we'll have to explain about his disease condition. That may be the problem, and according to your condition, we'll have to treat continuously. We have to continue the treatment like this, and you have to adhere to this condition like this.
Okay. What about others? I'll come to you. I'll come to you later. Therapy said first we can ask him about his wound, how it came, or knowledge about disease. Good. Okay. Then
Madam, maybe can describe about the wound, how the wound look like. Like you describe what is the size of the wound, how reddish, how infected, how deep inside, about the picture of the wound status, so that patient can understand the whether how the condition of the wound, and from there you can slowly speak with the patient and on like a teach patient how to take care, how to do the cleaning, how to take care from like for example you can teach them on food, diet, protein diet for the healing process. If I were the person, I will explain from here lah, madam.
okay, thank you. Do you think that the protein intake diet will improve, heal these kind of foods?
May not, but maybe not in a big scale lah. Maybe it's but somehow or other patient need the protein diet for the healing process.
Yes, protein
So
diet is good for wound healing. You are right. But in these kind of wounds, whether you just think about, you have to think about whether the protein rich containing diets will heal these kind of wounds or not. You have to think about that. If you suggest these kind of things, they will definitely take. They will definitely follow your instructions because they need to cure that wound, heal that wound totally. But we know, we all health professionals, we all nurses, we know this wound is not going to heal at all.
yes.
Then, so that we have to keep it in mind always. Then only you have to respond these kind of questions. Now we know this patient wound is not able to heal well. Again, he was asking you, my wound is healing well, isn't it? Okay. If you give a false hope to the patient, sometimes we just, okay, yes, I think it is healing. It is healing. So that is the small that overcome issues. So after 2 weeks, definitely the signs and symptoms and wound size will be increasing. That time, they will come to you and ask you, sister, you told me, no, my wound is healed, almost healed. I thought it was healed. Why? But now this condition is worsening. What is happening? Whether your ointment or your treatment is wrong with me, that kind of things will be there. So that is also that whenever we say something to the patients, you have to be careful. You have to give a proper instruction to the patient. Anna, do you want to add anything?
No, sister, you are right. We, in such situation, we may ask him that how was it before? He may have come after a month or so after developing dressing. We might be doing for the first time for him, but we can ask him that how was it in the past? So he is with the wound 24 into 7, right? So he also maybe judging something and he wants from us to know what is the condition, whether it is healing or not. So false hopes are no, definitely no. But we can ask him that, okay, how was it before 1 month, how it developed, whether it was increasing like that. So then we can tell him that, okay, we want to prevent further problems like yeah, say bleeding or more exudates like that. And how to prevent complications, we can advise. So that way it can be helpful, I think.
Yeah, you are right. So here, as Anna said, you have to that ask him about how was the size of the wound and whether there is any changes was happened. That kind of things. Just you should ask. You could ask him, and based on the answer, sometimes he will ask, yes, I think my wound is that size is increasing and the smell and the exudate is increasing. That kind of reply will be there. Sometimes false denial will be there. So they may understand the truth, but they may hide the truth and ask you something. They already know that wound is not going to heal and the size is increasing. That kind of things they all know. They may hide the truth and then they will ask you something. So what you can do is at least you can listen. You have to given maybe your facial expression. So you have to do the empathetic treatment to the patient, and you have just that show your emotion to the patients, like a facial expression and all. That time they will, he or she will understand everything. And also you have to ask few questions about the previous condition of the wound and all. Based on that, you can convey. So don't give false hope to the patient. That is very, very important. Don't give false hope. And another question is, why God punished me like this? So that is also the usual questions. What you have to do is just to listen and ask, why do you ask that questions? That these questions right now. You have to identify the cause first, because sometimes in the home also nobody is there to listen their problems. Nobody is there to clean his or her own. Nobody is willing to enter into the allowed to enter into the dining hall or work area or anywhere. They always keep the patient the on-site room. So that will be affecting the patient emotionally, socially, spiritually. All those things will be affected. So that time he or she come up with this question: why God punished me like this? If you do the individual assessment, definitely you will understand the truth. You can you can understand more about his family, and then based on that you can treat the patient. Okay, so this is also very, very important. If you do the individual assessment, you will get the full picture of the patient and their family. Anything you want to add, Anna?
No, sister, that's right. One has to be good listener.
Yes.
Most of the problems are solved there only. All the things will come out one by one. They will tell you so that you can you can develop good rapport with the patient and develop a good care plan for the patient.
And also the like BBN, the breaking bad news. The scenario you have, that steps you can just keep it in mind. Whenever you have you are planning to break a bad news. This is also breaking a bad news, because these kind of wounds are not going to heal. So non-healing ulcer. Whenever you break these kind of news to the patient, that is bad news to the patient. Okay, so you have to convey that way. You have to give a small tip at a time. Then after that, after 1 week, again you can give much more things, and then again step by step you have to break. Then they will understand well. And also, one of you suggest like, anyway, we understand that this wound is not going to heal well, but we are here to take care of your problems well. So that is the summarized word, and empathetic words like, they might be feeling like, okay, they someone is here to help them. So that kind of understanding will be there. So that empathetic treatment is also required to this patient and the family also. Our aim is to improve the patient's quality of life, uh, life of the patient and their family. Okay, so our aim. So how do you improve the quality of life of the patient and their family? So that is also important. When if you do the proper assessment, you will get a good idea about the patient. If they have a signs and symptoms there, try to reduce their symptoms. If you are able to reduce their symptoms, definitely we can able to improve the quality of life of the patient. Okay, so and the another important thing, so these kind of wounds are fragile. Okay, so if you apply more pressure on that wound, it will start bleed. So one thing you could suggest, if they are able to take a bath, the health condition, if the patient's health condition is okay, then you can encourage the patient to take a bath. So that time all necrotic tissues will fall off. Okay, so if there is the Anno had take a session about the signs and symptoms of wound. So there are a lot of the necrotic tissues. Okay, so all without applying your artery forceps pressure, that all necrotic tissues will fall off. So after that, you are just cleaning with normal saline is enough, and apply metronidazole powder. So that is the one important thing. You can just keep it in mind. If they are able to take a thorough bath, you can encourage them to take a thorough bath. Okay, and another thing is exudate. Exudate is also very difficult to manage. There are because of that. What the blood vessel, the dilatation of the blood vessels inside the tumor can cause lot of exudate. If there is a exudate there, sometimes we are not able to manage, because every 2 to 3 hours we need to change the dressing pad sometimes. So that is also the patients will develop anxious. Why is happened to me? That questions will be there. So that time you just manage with a diaper or a and that napkins, that kind of things you can safety first. These kind of things you can just think about that. You can apply the dressing pad first, and then you can that put a diaper piece or molina piece or that safety pads. That kind of things you can think about. And for malodor management, so if the patient is having malodor, the whole family will be affected because of the malodor. Nobody is willing to sitting in the room or sitting near to the patient. That will be affecting the patient emotionally. Because of me only, because of my wound only, they are not able to sit near to me, and they are not able to sit in their own house also because of me, my problem. So that is also affecting the patient emotionally. What you can do is you have to identify the problems and treat. Malodor management. Okay, so the metronidazole is one of the good medication for controlling anaerobic bacterial infection. What you can do is you can crush the metronidazole tablet and make it a powdered form and apply. And the another option, Anna already told, injection metronidazole. So there are a lot of maggot that pocket formation inside the wound. So if you use normal metronidazole injection, so that will be easy to go inside the pocket formation area and control the infection. So you can use injection metronidazole for irrigate the wound. And the another option is the nebulization. The same injection metronidazole you can use for nebulization. So that fumes will help to reduce the smell. So and another cost-effective and easily made in your own home is charcoal. So charcoal dressing is also important. You can take 1 or 2 pieces of charcoal and keep under the bed of the patient, or even you can keep it in the corner of the room. That will help to absorb the bad smell. So the charcoal is the best agent for absorbing bad smell. So these all way we can able to control the malodor. And the last one is bleeding. So you have to very careful for cleaning and dressing, because the dressings are adherents to the wound. Before removing all dressings, you have to soak the old dressing and try to remove the old. Okay, so if you are not soak the old dressings, if you try to remove the dressings, the adherents will improve the bleeding. If you try that time, there is a chance of bleeding. And the another thing is the tumor will protrude the major blood vessels. So most of the time, head and neck cancers, there is a chance of huge bleeding. So there is that tumor will be protrude the major blood vessels too. So in case that bleeding will be happen in their house, how will they manage? That is also, we have to prepare the patient family about the same. So Anna already shared, you have to use a dark color cloth. So that is very, very important. You have to, when you prepare the patient family, you have to make sure that there is dark color cloth is there in their home. So whenever the bleed happen, they have to use that dark color cloth for wipe out the blood. That will reduce the panic attack. Okay. So that these are the main the important points you have to keep it in mind while take care of these kind of patients. And the last point is maggots formation. So the patient doesn't know how does maggots come. We all know that maggots are come from houseflies, but the patient and the caregivers doesn't know. We are the person to teach the patient and the caregivers about the importance of covering and how to develop maggots. So if you teach well, definitely they will cover the wound properly. If they are not able to cover the wound properly, they will report you. Okay, so these are the important points you have to keep it in mind. I think all the importance points I mentioned. Anna, do you want to add anything? Any other
No,
doubts?
sister.
Any other doubts? So if they don't have any questions, we can wind up. Can we wind up?
Sister, thank you.
Thank you.
Sure, thank you.
Okay, thank you, Anna, for the wonderful session and contribution. Thank you, others, for joining today's session, and thank you for clarifying your doubts. Thank you once again. Thank you.
Thank you.
sister.
Thank you. Bye bye.
Thank you, ma'am.